Well, joining us for more on this is Dr. Samuel Okowo. He's a public health physician. He joins us here in Lagos. Thank you for joining us on the program.
Thank you. Welcome. All
right, now, it's still a pandemic. It's still a threat to the world. But then we're seeing Sunday recording 11 cases. What do you think is happening?
Personally, I feel it's a false representation of what is happening in the society. Really, fine, the incidence has dropped, which means we are not at the peak of it. The amount of people coming to the health facilities has really reduced. But this is not a time to relax because, generally speaking, the testing rates in our state have really declined. Basically, it's travelers that are really testing. So I can say roughly 90% of those recorded are travelers, not people coming down with symptoms.
So essentially, I mean, if it tells us states are not really testing, to the man on the street, it probably means that, you know, there isn't COVID-19 or there probably never was. But then we still have the NCDC that's saying it's operating the EOCs, the Emergency Operation Center at level 2.
Yes. It's the dynamic of the whole thing. Like I said, we are not at the peak. The amount of people coming down with the real disease doesn't mean people that have the virus. There are a lot of people that have the virus, but they're not coming down clinically. I think that's the good thing about the variants in Nigeria now. But this is where we need to pay attention. The India variant, which is more virulent than the variant we have originally in Nigeria, is now in the UK and other countries, and there's a light traffic load of travelers coming from UK and those countries. So this is where I think we need to raise up our testing rates so to pick these variants when it comes to the country.
So if we use Bayelsa State as a case study, the State's Ministry of Health says isolation centers are empty. They haven't experienced or they haven't had a case in over 2 weeks. And it says it's testing weekly. Figures like between 30 to 50 tests.
As I said, Bayelsa State has a case study. That is state over 1.7 million according to the census in 2006. So testing 20 to 30 people per week is less than 0.001% of the population. It's as if they're not testing. And like I said earlier, most likely those 30 to 50 cases are those that maybe go to the private lab to get tested, maybe for a personal reason or for some formal document. People are not, the state government in particular are not really going to the community, to the interland to check people whether they are down, they have the virus. So that's where I feel there is a problem. Apart from Lagos, that still opens their action centers for only hospitals to refer symptomatic patients. Hardly, technically no other state is testing actively.
So what should government be doing?
I would just advise government that this is not a time to relax. Find the variants in Nigeria has been less virulent than other strains. There are a lot of postulations to that. Some said the weather, the nature. But the good thing is people are not really coming down with the frank disease like in the Western world. So I would only advise the government to at least brace up the testing centers and follow up the people coming into the country, just like they did last week or 2 weeks ago, releasing a list of people that evaded the mandatory tests just to brace up our testing, especially for
All right, thank you so much. Thanks a bunch, Dr. Samuel Okowo, public health physician. Thank you for joining us.
Thank you for having me.